Assalamu alaikum ji. My name is Professor Dr. Syed Nadeem Rizvi. I am ex-professor of interventional cardiology, Professor Emeritus at National Institute of Cardiovascular Disease, and presently I am the Director Cardiovascular Services Department at the OMI Health Network. First of all, I'd like to congratulate Mr. Asadullah Bhatti Saab for his very well-deserved appointment at the Pakistan British Business Council. And he has asked me to give you a little brief on the state of interventional cardiology in Pakistan. So let me take you back to the 1970s. That's when the first angiogram was done here. People used to go to Britain or Europe or US for interventional procedures. But since the 2000, the interventional cardiology has come of age, especially due to the efforts which were dedicated in Karachi and in Sindh related to the National Institute of Cardiovascular Diseases, which started a 24/7 primary PCI program, and this they expanded to the rest of the province, where anyone within an hour or so of his chest pain could present to a National Institute of Cardiovascular Diseases satellite center or chest pain unit, and then used to have a free of cost angioplasty. This has now expanded to being one of the largest program of primary PCI in the world, with the volumes of around 40 to 45 patients with STEMI in Karachi alone, in NICVD Karachi, which is a 800 to 900 bedded facility, and its satellite centers in the whole of Sindh, where between 10 and 20 angioplasties are done in about 15 centers throughout Sindh. Now, not only in Sindh, in Pakistan, the other biggest province is Punjab. So it was a little bit, it lagged behind a little bit, but since the 2020, it also has started to expand its 24-hour services. So anyone with a heart attack can now get a free angioplasty in most public sectors in the whole of Pakistan, including KPK. Balochistan is only limited to Quetta. Now, apart from angioplasties, which is the most commonly done interventional procedure and saves lives in an acute case, other state-of-the-art procedures are also being done in Pakistan. So, bypass surgery has been there since the 70s and late 60s. The modality of doing bypass surgery has changed a little bit with more contemporary equipment, and now minimally invasive surgery is also available. Valve replacement surgery, percutaneous valve replacement, which is called TAVI, is also available here. So essentially in Pakistan, in cardiology, most of the things which are available in the Western world or North America, including North America, is available here. The only restraining factor is the cost. So for example, for support devices, myocardial circulatory support devices, like Impella, which costs around $25,000 to $30,000 to support a person, there's not real data which has convinced us that we can spend that much money, and obviously it's not cost effective to do that in Pakistan. So the circulatory support and these kind of very expensive equipment is yet not available here. The other limitation is the cardiac transplant. Again, very few procedures are done worldwide cardiac transplant, and so that is not yet, cardiac transplant is not yet available, although in 2018-19 NICVD did carry out a few left ventricular assist device procedures, which is called LVAD. So essentially the training, the manpower in Pakistan is there, and I was part of that training process, where now there's a second fellowship. Now, as the manpower of interventional cardiology is concerned, we have now got a second fellowship, which is equivalent to the American board in interventional cardiology. So after doing the basic board in cardiology, which is called FCPS, Fellow of College of Physicians Surgeons in Cardiology, the postgrad, now the consultant status or the attending status person embarks on a 2-year further training program, which is related to interventional cardiology, where he is exposed to structural, peripheral, coronary, and disease procedures in major institutes which are recognized for these programs. And after 2 years of training, he then has a period where then he has to attend to clinical work, and then he appears in interventional cardiology exam, which is called FCPS in interventional cardiology. It's a tough exam, but now a lot of people are passing that. So we have got now the second fellowship, and these super specialists, as they call, are now spreading all over Pakistan. And I think in 4 to 5 years' time, there will be enough manpower of specialist cardiologists, and so the procedural volume is definitely going to go up even further. Even nowadays, with the volumes that I told you about, 15 to 20,000 primary angioplasties in NICVD alone, this is enormous, tremendous volume, and obviously the training facilities and the data for research is available. Research is also one of the key issues that has been taken up by various tertiary institutes. So, in conclusion, I would say that cardiology in itself has progressed quite a lot with us, for example, having come back from Europe and from States. Our generation has now trained enough people who are now being taking training locally and abroad, and then further training there. So there's a leadership which is now being incubated, and the program of interventional cardiology and the procedures are now on their way up, and they will continue to go up, and this will translate directly into the improvement in the care of cardiac patients in Pakistan. The only issue, restraining factors here, is the cost of these very high-tech procedures. But I think there's, with the support of government, which already, in especially the government of Sindh and now the Punjab, is also supporting these procedures. So I think there is the future of cardiology, of interventional cardiology in Pakistan, is quite secure.